Hi, I'm Geoff Jolliffe. I'm a GP locally and I'm the chair of Morecambe Bay CCG. I just want to say huge thank you to the public of Morecambe Bay. It's been really encouraging, the support we've felt from you, from the clapping and the banging of pans that I heard last night, right through to the messages on social media, and indeed all the things that you've done, particularly adhering to the rules, which actually really supports the NHS. So thank you. You wouldn't recognise general practice at the moment. If you haven't been to a surgery in the last few weeks, it's completely different, and it may feel a little bit alien. I'll just ask you to bear with us. So all the doors are locked. That's not because we don't like you. It's just that we want to keep you out and reduce the risk of infection, and we'll only see you if we really need to. So mostly things will appear normal to start with because you'll ring the surgery hopefully and we'll try and deal with you over the phone. But if we need to do more, we will, such as a video call, or we will arrange to see you face to face. I'd like to point out that we're particularly worried about people not turning up, not using the NHS. Now, to a degree, that's really responsible and giving us space to operate and look after the seriously ill people with coronavirus or COVID-19. However, we are concerned that there are some people with significant illness, significant symptoms who aren't using the NHS. The NHS is still open. Please contact us. We may not see you, but at least we can check out whether we need to. You may have been told you're high risk or even very high risk, which are called shielded patients, and if so, you'll have received a letter from the government. Patients who are high risk should do a few things. Firstly, do the general things that everyone is being asked to do. Stay at home, social distance, wash your hands. If you're in the very high risk group, then don't go out at all. Get other people to do the tasks that they need to do for you, like shopping, medication, and the like. This is a virus that, according to different estimates, 40 or 50% of people don't even get any symptoms, which is good, but also that's the danger because you can pass it on without realising it. Of the people who do get symptoms, most get a mild to moderate illness. And I have to say that's particularly true of children. So if you've got children, you're worrying about them, you don't need to, unless they get severe symptoms, in which case you should report it. There are sadly a few people who get more serious illness, and that tends to be in the elderly, frail, and those with a lot of chronic disease. The million-dollar question is, how long will this go on? And the answer is, I don't know. But let's look at the likely scenario. The disease is reducing in its severity at the moment in terms of less deaths and less new cases. And if we continue our social distancing measures, then it's likely into the summer there'll be very many less cases. Ultimately, the problem will be solved when we develop a vaccine, and will be helped if we can develop effective medications. Research is going on at the present time. The very earliest we can anticipate a vaccine is probably late autumn, but it could be into next year. So we should get through the immediate peak of the crisis, but it's likely that we'll have ongoing problems for many months to come. Finally, if I could just say a few things, thank you as an individual and for your communities for actually coping with these severe restrictions that have been put upon you. It's really important that you continue to do so. Thank you for coping with a health service that's working completely differently and maybe strange or even a bit daunting to you at the present time. Work with us on that. Remember that the NHS is still open for other illnesses. So if you have significant problems, please still use us. And finally, the three things that you're asked, please do them. Stay at home, social distance, wash your hands. Thank you.